And investors go like, whoa, 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 that's grant funded, I'm not interested. I love early stage startups. They did it by never saying public health. There are many people like me who are very willing to hold hands and get people in the right doors, and that it's gonna automate like dumb stuff. Like healthcare is wild in the US, like it's totally crazy. I think working in a vacuum really sucks, and your product is gonna suck, and you know, people like me are gonna think you suck. Like it's just gonna be the worst. We need more innovators in Medicaid. We need more innovators in public health. Like God almighty, please come.
Hi everyone. We continue to introduce you to amazing people and amazing digital health experts, and we continue to share their knowledge and expertise and some of the insights that hopefully gonna help you to make your startup journey a little bit easier. It's still gonna be hard for sure, no doubts about that. I don't know a single startup founder who came up with an idea and the next morning he's a billionaire. That's not how it works. But at least we hope that some of the advices that you hear on our channel and today specifically might help you to avoid some of the mistakes and failures other digital health startup founders met. So please like this video, subscribe to our channel. And finally, I'm super happy to introduce our today's guest. Her name is Kat McDavitt. Hi, Kat.
Hi, thanks for having me.
Thanks for accepting my invitation. Let's start with your short intro. Please share your story and how did you end up in healthcare?
Yeah, it was a mistake. I feel like a lot of people will say that too. Honestly, I started my career during the Great Recession. I was actually doing communications for architecture firms, and you may remember no one was building anything through the entire Great Recession. I thought, I was gonna make up my salary cut that I had at the architecture firm I was working at. And honestly, I think I just looked on the internet and found an ad for a freelance copywriter at a healthcare technology or health IT communications firm. And I was like, what's that? But I went to the interview and they said, why don't you just work here? Why don't you quit your job and the end of the world? And I was astonished that anyone was hiring in healthcare. And that seems to be the thing, right? That was a recession-proof industry, and healthcare technology at the time was being spurred on by the HITECH Act, which was part of the American Recovery and Reinvestment Act. And I was just astonished that all this stuff was going on when in other parts of the country, other industries, it was just tanked. So I jumped over, I started doing client work, communications work, mostly and strategy work for companies in the health tech space, and I kind of never left. So here I am, and then I spent 7 years doing that. The company was called Dodge Communications. I was there for 7 years. I worked with all kinds of awesome brands, NextGen, Cario, MDion, which is now Change Healthcare. Got a ton of great experience. I loved it. I loved kind of the intersection of policy and technology and how that really made our sector a little bit different. I thought it was really fun and really interesting. I loved the whole Medicaid market. And that's where I really got interested in that. And then the death of all good things happened. We got acquired, which is amazing if you are a founder or someone with ownership, but I was little back then, so I did not. It ended up being a great company, just not the direction I wanted to go in. Then I started Innsena to kind of do the same thing. I was like, I kind of love what I'm doing. I want to keep doing it. And then about a year in, I fell in love with one of my clients, Collective Medical, who I still work with today as part of their Acquire or Point Click Care. Not the death of all good things. It's really fun to be a part of that. Came back to Innsena with my now business partner, Leslie Kirk. And I have a practice that pretty much solely focuses on growth in the Medicaid and public health markets. So startups that want to work in innovating with those populations, usually the underserved. It's about 25% of the country is either using or in some way adjacent to the Medicaid as a payer. And public health, it covers everyone, right? Everyone in the country, whether we're talking about COVID or we're talking about behavioral health, cancer, all kinds of different disease states in that part of the world that I really care about. So that's what our work is right now. We still do have a communications practice that Leslie runs, but my business partner, but we're primarily focused on growth in those areas. So it's really fun. We see a lot of startups up here in New York, where you'll meet many of them too. So yeah.
Amazing. So while preparing for the interview, I made research. I went through your LinkedIn page and all that stuff. By the way, lots of great digital health content. Kat is also a co-host of healthtech talk show and has some really amazing guests there. And so highly recommend to follow. We'll definitely leave a link in the description of this video. So I found out that 2023 was very productive and successful for you in your business.
Yep.
While the whole industry was not doing that well, like record low in investment, lots of companies went bankrupt, layoffs. How did you manage to maintain the growth and expand your team?
Well, first, I have a great team. I did not do it by myself. I have a great, awesome team. I could list them all here, but I'd say one of the reasons we had amazing growth at Innsena is because we are focused on what is actually a government payer, right? Often when you see private money decline, you see public money increase. And that's actually a strategy that we have in terms of how we make sure Leslie, Kirk, and I are very conservative when it comes to money. So we want to make sure we always are able to keep our people and that we plan ahead. So we did have an intentional strategy to make sure that we were focused more on how we support government-funded programs and then while maintaining our private sector business. And I will be honest, we did definitely see a little bit of shake with our private sector clients. A lot of them were just not able to secure funding. Some of them went away. It's really, really sad. But we know that's kind of how the markets go. So looking ahead, we made a big effort to kind of shift the balance of our work so that we do have some work that's directly funded by the federal government. We have a lot of work that's funded by the states and Medicaid. I'd say our portfolio is about a 50-50 mix right now between private sector and public funding. We also serve a lot of public-private partnerships that kind of help us bridge in between, so it's not a hard shift. It can be really hard to be commercial with some of our very private sector clients and then shift over to, how are we supporting the CDC Foundation as an example. But that was intentional, and that's one of the reasons we have grown and done well. It obviously looks like we just sprinted through, but that kind of work, being able to secure clients in a more stable public market, and by public markets I do not mean the stock market. That's something we started a year and a half ago. So that would be advice. That's consulting advice. I don't know if that's going to apply to some companies that are springing up in the private sector right now. But it was intentional, and we're also in a niche. And what do they say? There are riches and niches. And I would say that's true, right? We are very focused on, again, Medicaid and public health. And we know a lot about it. It's in a relationship business when you get into a world that small, and we're very good at it and take it very seriously. Our reputation is kind of all we have at the end of the day, and my team is hyper-focused on making sure that we deliver and that we have that amazing reputation.
All right. Well, we'll talk about public health in a second. One more question about Innsena. For early-stage digital health startups, when do you think is a good time to reach out to you, like for some go-to-market strategy, marketing campaigns, stuff like that?
So I'll say this. So I love early-stage startups. It is very difficult for an early-stage startup to afford to work with a firm like Innsena.
Right.
So I would say our sweet spot, the companies that we typically work with that can afford to work with us long-term, we only take on engagements that are on retainer, so long-term, especially because it's a relationship business. Mm-hmm. We're not gonna do a 3-month project and hope it worked out, right? We're gonna be there for the long term. We help our clients build those relationships. So I would say it's probably Series A to C.
Okay.
We have a few seed clients, because seed rounds are big these days, if you're able to secure one. But I'd say I am always willing, and my team is always willing to help early stage companies. The ones that actually end up engaging with us long term are usually a little bit more mature.
Okay.
Happy to point you in any direction though, happy to give you a call, happy to do a consult, but that's largely because we care about Medicaid, we care about public health, and we know a lot of the newer companies getting into this space just can't afford that work yet.
Right. So public health, I think it's obvious that there is less innovation than in private sector. What do you think are the main barriers for digital health innovators to get into this?
To get into public health. So this is a tricky thing, and I think about it a lot. I think oftentimes also investors, right? A company will say, hey, I'm interested in public health, and they might be focused on, maybe a very transactional function in the public health world, like because they've been hearing about vaccines, immunization registries, big things like that because of the pandemic. And investors go like, whoa, that's grant funded, I'm not interested. And what they don't realize always is public health is way more than what we just dealt with in the pandemic, depending on the state it's over or not, whatever. Public health is so many things. It's cancer, it's behavioral health, it's SUD, it's all those things. It's big things. It's diabetes, right? It's all kinds of big things that affect our whole country and whole huge populations, including me and you. So I think that the advice that I would give a startup that's focused on public health, assuming we're talking in the same language, right? We're not talking about like something boring like, sorry, CDC, e-case reporting or something boring. Important but boring. I would say make sure you're talking about it in a way that someone can understand. And investors are smart people. All their customers are smart people, but just the way we talk about things makes a big difference. And that's, I think, from my communications background, I think that's one of the biggest things that makes me and my team successful is we're not going to say public health broadly. We're going to talk about cancer, right? We're going to talk about opioid use disorder. And those are public health issues. We're just not labeling it that way. And I think that's where people run into trouble. The great state of Indiana recently had a huge victory with, they have a phenomenal public health program that they've been able to push forward despite being what we would call a red state, right? More conservative. And they did it, and they said this in a political article, they did it by never saying public health. And so that's the advice, unfortunately, because I do think we should be able to say those two words together. But I think the messaging is more important than anything when you're really trying to get leverage in that space.
Cool. To kind of wrap up everything you just said, can you talk right now to all the startup founders that are watching us or listening? Tell them that don't be afraid to move into that space, come up with solutions that are supposed to help public health.
Yeah, so I will say that about Medicaid and public health right now. So I just got back from the JP Morgan conference, and I'd say the sentiment is as usual with investing in those areas, right? It's kind of like there are some investors willing to take the risk on startup founders who want to work in Medicaid and public health. I don't feel like there's going to be a lot more investment in that space, and I think that's where I talked about it on LinkedIn a little bit. I was disappointed that was the sentiment that I came away with. But that doesn't mean there's any less funding than usual. I think that's actually the same. So it's the world many of us already know. Don't be afraid to get into it. My good friend Chris Klump and I just did a masterclass with Startup Health yesterday, talking about Medicaid and how to get into that market and why you shouldn't be scared of it. You shouldn't be scared of it. Public health is a little tricky. I think, again, if you can talk about it in a different way that's focused on different clinical use cases, you're going to win. With Medicaid, what you'll hear from a lot of investors is that Medicaid's hard. It takes too long. It's different. There are too many markets. Well, there are 50 states, last time I checked, and that's actually not a lot of customers, right? That is actually a very small customer base. So I think that what I always tell people, and I think what Chris and I told our audience yesterday, is don't be afraid to work in those markets. Don't be afraid to do the little bit of extra research that you need to get in. You will need to Google a little bit more, but it is a worthwhile place to be. There are not a lot of companies that invest in that space. And by investing, I mean investing their time. So if you get into it, there's not going to be, you're not going to be fighting around and elbowing everyone that wants to work with Medicare Advantage, right? That's a small pond with a lot of fish. This is a big pond with not a lot of fish if we're talking about Medicaid and public health. So there's huge opportunity, and I strongly encourage you to look into it. It is not that hard. It's a relationship-based business, but anyone can do that. And in fact, I think that that's one of the benefits. You might get into a place where you're talking to investors and they say, it's a relationship business. You have to know someone. Great. That means you don't need to hire 400 SDRs and call everyone to get someone to pick up the phone, right? You can work your way in as a founder, as a company of 4 or 5 people, and sell your idea that really could make a big difference to a Medicaid agency, to a Medicaid plan, to a group of FQHCs. Like, you can do really amazing things if you focus in that space. Strongly encourage you to continue building.
Thank you. I think that was super important.
Yeah, those big feels. Yeah. I mean, this is something that I am very passionate about. I want more investment in the Medicaid and public health spaces, and I want more founders building in it. And that's hard, right? It's chicken and egg, right? Yeah. What's going to happen? And so whenever I can, I try. That's what I'm talking about earlier. Like, maybe someone can't afford to work with us, but please reach out. Like, we will help you. We will introduce you to the right person. We'll listen to your pitch, and we'll help you at least get where you need to go. You know, from there, it's up to you. But there are many people like me who are very willing to hold hands and get people in the right doors, even if we're not getting paid for it, because this matters. It really matters. It's, in addition to being a huge chunk of the country who are covered by Medicaid and depend on it, many moms and babies, by the way, over 50% of US births are Medicaid births. This is a group that needs innovation, that wants innovation, and what founders hear is it's just too hard to get funding in this space. So lots of people like me are going to help you. Call me, text me, DM me.
Cool. Very cool. You probably, over the past years, you've met so many startup founders. Some of them are probably right now are successful companies already, not a startup. A lot of them failed, like you mentioned in the beginning. What would be your recipe for a successful startup in digital health, and what are the secret ingredients?
In general? Mm-hmm. So in general, if I'm getting off the Medicaid pedestal, the founders, and I was lucky enough to work with some really incredible founders at Collective as well. I'd say it's understanding your value and focus. Many of the companies I work with that don't make it, every day we're making a different flavor, right? Every day we're making different kinds of soup. Sometimes we switch from soup to we make chili, right? Like, it's hard, especially when you really have to dig to get customers these days before you can get that funding. So I think that's where sometimes founders get led astray, is they'll acquire a lot of different customers, and they're doing something different for each, and then they run into a solution that's not scalable. Mm-hmm. And I think that's what I've seen maybe the most in 2023 is Hail Marys trying to get customers so that they can prove that they can get funding. And what they end up with is a hodgepodge that doesn't make any sense. I've also seen some companies go from being a product company to a services company. That's hard too, or not necessarily delineate between the two well enough, and then that kind of causes their great demise too. So I'd say focus and really understanding what you're good at. The startup that I was with, Collective Medical, we had a product that a lot of people said we needed to expand out from, right? So it was care coordination. It was ADT based, and it was the entry point for us was the emergency department, which is like not super well funded, in case you haven't noticed. And it was a Medicaid play. And we always heard, oh, you need to get into Medicare, you need to do SNF stuff or whatever. And it's surprising we were purchased by a company that is the largest SNF EHR. So we definitely got into that after the acquisition. But we focused, right? We continued to sell to the emergency department, and there was no one else there. So I would say that focus, find your niche, find what you're good at and stick to it. And if someone tells you to pivot, like, just make sure you're doing that for the right reasons.
So it's still pretty early in 2024, so I think it's still a good time for some predictions. What should we expect, Kat? What are predictions for digital health?
My predictions in general for digital health in 2024. So my health tech talk show co-host, Lisa Berry, always tells me that I am prepared for the long, cold winter, and that I don't think the market's ever going to get better. I do think we're going to see more investment in general in 2024. At least I freaking hope so. I don't think we're going to see too much more in Medicaid and public health, like I've already said. I think from a trend perspective, I think AI is going to continue to be a thing. And I've had a couple guests on our talk show as well that gave a similar opinion to what I have. I don't think we're going to see like anything
revolution.
Yeah, like, I mean, I think AI is changing the world, but I don't think we're going to have like monumental, wild, like, oh wow, now we don't even need to go to the doctor anymore type AI stuff. I think one of our guests, Nikhil Krishnan, said this, and I very much agree with him, that it's going to automate like dumb stuff. And I agree with that. I think some of the suggestions are like scheduling, physician co-pilot, that kind of a thing. Administrative work. And I think that's really important because we do have a staffing shortage. So the more we can free up the time of clinicians to not do those things and like focus on patients, the better. But I think we'll see more and more of that. Women's health. I would like to talk about this. So I would love it if we saw a ton more investment. And I think a lot of people are predicting that we will. I would like to, you and me in 2024, end of 2024, we're going to be in New York City and we're going to have drinks and we're going to see if anyone actually invested more in women's health this year, because I am not like totally feeling it. I think there's a lot of talk. I think there's a lot of buzz. But I think when push comes to shove, I don't know if we're actually seeing that investment yet. I hope so, but my prediction is that we won't see much more this year. I think we'll see a lot of like AI,
of course,
administrative stuff. So I think that's what'll happen. I'm very excited too about companies that are capitalizing on some of these enhanced care management reimbursement opportunities that we see with like the New York State 1115 waiver that was just passed, as well as California has had that for a little while. I think that's really important to show how tech-enabled services can really make a difference, especially, again, for the Medicaid population. I'm very excited about it. Sorry, that was a lot. It was like a lot.
I love it.
I was getting excited.
some great predictions. Let's check what if they're
2024. We'll have a drink.
Yeah, for sure.
Yeah, right here in the chief offices.
So finally, you've already said so many great recommendations for Zorya founders. One last piece of advice for founders.
One last piece of advice. This is going to sound like mushy. I'm going to say it anyway. Meet people and ask for help. I think that like healthcare is wild in the US, like it's totally crazy. It's really confusing. And even if you've been in it, even if you're a founder who comes from a health system or you've always worked in tech companies, just meet people and meet your customers. I think that's probably the biggest thing. The startups that I work with who succeed, they really, really understand their customers and their buyers. And sometimes those are different, right? Users and buyers are different. So learn who those are, talk to them a lot, have relationships. You're going to learn so much amazing stuff, which is going to make your product and your go-to-market even better. I think that I do meet a lot of startups who like have never talked to their customers or never talked, sometimes they don't have customers, right? Pre-revenue, pre-product, and they are trying to figure out what to do next. And they've never like talked to an FQHC or talk to a hospital administrator. And I think like, just do that. Find someone who can help. I'll introduce you to them, right? It's gonna make everything better. I think working in a vacuum really sucks and your product is gonna suck and people like me are gonna think you suck. Like it's just gonna be the worst. Yeah.
Great ending.
Yeah. Also, I forgot to mention too, so the talk show, sorry, I was like getting caught up in my bio. I also, I'm the CEO and founder of the Zorya Foundation, and which is a nonprofit, a C3, 501c3 that I started about a year and a half ago. And it gives out cash grants to women working in the healthcare field, primarily for childcare and caregiving. Yeah, most of our work is just giving out cash grants to nurses and CNAs and MAs to help them stay in the workforce, because we have a healthcare worker shortage, and childcare is one of the reasons I've been able to be successful, is because I've always had access to high quality childcare and was able to work and didn't miss opportunities, and many women don't have that.
I was actually going to ask you the name of the fund. Is it a Ukrainian word? Or?
It is. So so Ukrainian. So if it's interesting for your loyal viewers, my last name is McDavitt, but it's my married name. My maiden name is Kovalchik, and my whole family is very much in the Ukrainian region, depending on when they came over. And so for me, Zorya is the Slavic goddess of the dawn, I believe. I had a very good friend help me name that, Tom Novak. And for me, when I was, nursing my kids in the middle of the night and working, and it's that time of your career when most women have children is, when it's really taking off. And if you miss things, you miss things. And it's unfortunate that that's the way it is. And I remember just like 2 a.m, like nursing some baby and being like, God almighty, like I am not going to make it. Like I got to quit. And when the sun came up every morning, there was some serotonin hit or something. And when it was dawn, I was better and I could handle it. So the dawn thing is, I want this fund, I want this money, this cash to be kind of like the dawn was for me, something that keeps them going, to stay in the workforce, keep helping people, because nurses, all kinds of clinicians, we need them. And we're kind of screwed without them. So that's the name. Yeah, very Ukrainian. So when Alex reached out and said, hey, I think you had seen one of the talk shows. Mm-hmm. Yeah, Alex had seen one of our talk shows with me and Lisa, and I think we were talking about Ukraine. Mm-hmm. I can't remember exactly what we were saying. We were probably bitching about how the U.S. is not doing anything and, whatever. We can talk about that later. I don't know how political we're getting here with the lights off, but Alex reached out to one of our emails and was like, hey, do you want a real Ukrainian? And we were like, yes. So very supportive of our friends in Ukraine and of Alex and his company.
Thank you very much for that. We really appreciate it.
Yeah, well, hopefully we stop swinging our dicks around over here and get you guys some money.
Well, thank you, Kat. That was amazing. Please, again, subscribe to our channel, like this video, follow Kat. Apparently, you can reach out to her for...
Yeah, call me.
Yeah, call Kat, and she'll solve also your problems.
All your problems. I will at least point you in the right direction and give you some contacts if I have them, for sure. We need more innovators in Medicaid. We need more innovators in public health. Like, God almighty, please come.
Thank you. Until the next time.